Smile and show those pearly whites. We're about to embark on a healthy journey. You are listening to the Whole Healing Radio Show with your host, integrative dentist Dr. Amy Dayries. Can our teeth be the roadmap to our health? Well, Dr. Dayries will be exploring new pathways to pairing dentistry with health, showcasing cutting-edge medical practitioners from around the world. She will shine a light on natural healing pathways that get you and your family accurate and empowering information to live the life you desire. Discover empowering life strategies as she integrates dentistry and whole body healing. So show off your smile. Your health can use it.
Good evening. You're listening to the Whole Healing Radio Show with me, your host, Dr. Amy Dayries. I'm a dentist outside of Atlanta in a little place called Roswell, Georgia, that we've grown up in. It's grown a lot. And tonight's guest is Vander Stoep. She is a hygienist, and I got to meet Carol about a year and a half ago at an ALF conference. And Carol believes medicine, including dentistry, is next in line for positive disruptive change. She's written 2 highly acclaimed oral systemic medicine books to lay out what those changes should look like. The books are Mouth Matters, How Your Mouth Ages Your Body and What You Can Do About It. And the other book is called Primal Dentistry, Less is More. Carol also offers 2 online video courses that are available for continuing education for all types of dental professionals. And the first video is called Functional Medicine from a Dental Perspective. It actually is 36 hours of AGD, Academy of General Dentistry approved CEUs for medical dental practitioners of all whom should thoroughly understand the myriad connections between oral and general health in order to help their own clients and themselves and their families achieve optimal health. She highlights many key points that I've really not seen anywhere else in a dental perspective in her abbreviated series geared towards the general public. And she really breaks it down to make it really easy and to understand a lot of pretty complicated science stuff that you really need to know about to live your best life. So without further ado, Vander Stoep, and thank you so much for coming on. I'm so excited. We've been planning this show for months.
Yes, we have. But we're both
tell everybody what happened. Yeah.
Oh gosh. Well, we were set up for May, and I missed it because I didn't have any. I was in Refugio, Texas, which is a lovely little town, but even though I was practically sitting on top of the router, we had no connection. And you ran into that a little bit where you are today. So we had to scramble a little bit, but here we are. And I had really wanted to be on that radio show, but it just didn't work out. So I'm glad I went there because what I was doing was filming with a brilliant doctor who pretty much brought what we call air abrasion and early correct diagnosis into a little bit of popularity, not enough within dentistry. And so what I was trying to do, I think when we film things, as opposed to when we have dentists trying to go to, little seminars and stuff, you can bring it to a broader group. So yes. What I was doing was filming early correct repeatable diagnostics, which I think needs to be a part of every dental practice, but it just isn't yet. And
tell us what that is more. And I know what that is.
Yes, I know you know what it is, but when we go to the dentist, we expect to have decay caught in the very earliest of phases. And unfortunately, when we use 1850s technologies, which is just an explorer or a pick and x-rays, that just isn't going to catch decay as early as it should in order for us to maintain our teeth for a lifetime. And I think that is probably the most important thing that we need to bring about. And I expect most of your listeners have gone to dentists who are only using that, and it just isn't adequate. And if I can just tell a story about someone very close to me that, I cleaned her teeth just a little bit ago, and I don't work very often anymore, but in that dental office, all I have is x-rays and an explorer. And she had absolutely no decay, according to what I could tell. But I had just had a booth called Primal Dentistry at the PaleoFX conference, and I met a dentist who was starting to have some toxicity problems due to the profession that we have. And so she became a biological dentist. She learned an awful lot, and she had invested in one of the things that I like called the So Pro Life Action, which who cares what it's called? It's a way to visualize what's going on. So if you shine this light on the tooth, green light shows that it's fluorescing beautifully and it's a natural tooth. The red light is like, okay, you've got some decay there. And then what I really like about it, especially for dentists who use ozone and are trying to remineralize early lesions, the black shows that, you're being successful in remineralizing it. So even though she looked pristine to me in the typical dental office, I went ahead and paid to take her to this other office just to use the SoPro, and
cool.
Had a little bit of decay on every molar.
Oh, wow.
So, so then I took some air abrasion and, cleaned out those little grooves and, we filled them. But, the structural integrity of the teeth was able to be maintained because they were all in the most incipient phases. And one of the things that I talk about in primal dentistry is that there are 3 ways teeth decay from the inside out. And most dentists aren't aware of it. And it's just really important to know that part. So I go into all those 3, both in my videos and in both books, to tell you the truth, because I think it's so important. But those little pits and fissures are so important to catch. And if you catch them early, then you don't have to be invasive into the tooth at all. So
that's true. And one of the things I'd like to mention or add on to what you're saying is that there's just certain types of bacteria that cause these types of decay, or that cause gum disease. And I think we've been in this mindset that we want to kill everything in the mouth that's bacterial. But we have to have a certain ratio of a lot of bacteria, but we want certain ones, or a lot of certain ones. And medically speaking, we call those our old friends. There's an old friends hypothesis is what it's referred to in some of the medical circles. We've lived with these bacteria for eons, and they enable us to make nitric oxide, which help us remake and vascularize our whole circulatory system. We have to constantly make nitric oxide, and that bacteria in our mouth enables us to make up to 40% of our nitric oxide. So anyway, I just wanted to point out
on the back of the tongue, especially, right?
Yes.
So I talk about, and it isn't just, and here's another thing, it isn't just about the bacteria. You have all kinds of microbes. So I'm not really antibacterial anyway, because if you knock out all of that, then you have, say, viruses, and you have a lot of older people who have a dry mouth, and then they have these oral candida infections, and that's where you get your root decay and so on. So
yes. Do you want to elaborate a little bit on the grooves and the things you talked about the structure of the teeth, and because these things we're still not teaching them in all the dental schools. It's going to take, unfortunately, a few more years probably to get that in the curriculum.
I hope it doesn't take too long. One of the things about this gentleman that I work with sometimes is that he has discovered some crazy. The dental schools completely ignore, for instance, this enamel network that runs underneath the enamel, not underneath the enamel, but crosses through the teeth in an unusual way. And dental schools are still teaching to obliterate that, with a drill. So most of the dentists that I work with, or, with whom I coordinate, they never use a high-speed drill at all, because it's really too easy to blast through some of these very wonderful enamel substructures that hold a tooth together. So I have pictures of that, again, in my videos. So there's that. And then that whole rim across the top of the tooth, I call it like it's the top of a bean can. If you didn't have that lid there, if you didn't have that peripheral rim that's folded over several times, the whole thing would crumble pretty easily. And so, but if a person has decay on the side of a tooth, dentists are taught to just run right through that. And then, of course, the filling will break down. So there's a number of wonderful structures within a tooth that help hold it together. And so minimally invasive, catching decay early, all of that's really very important. And I would say that a biomimetic dentist who is trying to copy nature, which, like in architecture, Gaudi just said, we just have to follow nature, right? Because it knows best. They would never consider, or almost never consider, taking all the external part of a tooth out in order to fabricate a crown, because it doesn't allow the tooth to, all the forces are then forced along the outside of the tooth, right along the gum line, and they're not passed through to the root so that the tooth can remain structurally strong.
I do want to point out, like, one of the reasons we kind of sometimes, I think, have to date ourselves when we talk about what we know now. A lot of these things we might not have known, or we
Absolutely.
needed some more time and decades to prove these things. I remember I got out of dental school in 1996, and my husband's a mechanical engineer. And I know, so I really appreciated the part in your primal dentistry book about where you break down sort of the engineering perspective of how you, or when you're talking about obliterating tooth structure with a high-speed drill, why that's a problem. And I remember coming home from school and I was showing him, like, this is how we're doing this. And he'd be like, Amy, I don't understand this. This doesn't make sense. And I'd be like, listen, I'm in dental school and you do you and I'll do me. But, it was, looking back, he saw it right off. And
engineers he's
pretty smart. He was a nuclear engineer on a submarine, and he can, he's a thinker. So I really appreciated that part of your book. And we have a different technology. So one of the things that we didn't have back then. So back then we still were saying we didn't have good dental materials for posterior teeth, for back teeth, that were not metal based. And we needed the metal to be a certain thickness to allow the filling to hold up. But now we're in a different age. We have different materials. So I just wanted to say that, because I don't think anyone goes into this trying to do a bad job. We want to do the best job we can and help people, not harm people.
I myself
we have to keep that.
Before I understood, and I wish I had understood it earlier, but I have a crown that was predictable. You could have predicted that my tooth would break around this filling that was done that way. But no, we all have to start from where we are. And I'd say that our generation, when I'm much older than you are, but I mean, even your generation has a lot of dentistry that, doesn't follow.
It doesn't. So we're working on that. And it's also about opening minds, because it's really difficult when you go through a program and everyone's being taught the same thing, and then that's what your board is on. And it's kind of like saying, if you were taught that the earth was flat and all of a sudden now it's round, or vice versa. And it can be very difficult to wrap your head around a paradigm that you were taught was absolutely not a possibility.
That is a tough thing. And I do think it needs to start in the dental schools, but it's so easy to pass things down. But as I said, this gentleman has come up with some really cool stuff, and it's going to hit, I hope it hits in a big way, that we cannot continue to teach the way that we're doing, because that's really where it happens. And at any rate, we do have to be where we are now. And one of the things before I don't know whether we're near needing to go to break, but, the whole thing about the whole thing about composite fillings, I mean, it seems like a wonderful thing, but I think that this is where biomimetic dentistry is so interesting. A lot of dentists don't know that they can't bulk fill a tooth. They can't just put these composites into the hole they drilled out, or that's there from other dentistry, and expect it to work. Unfortunately, we know now that basically they shrink towards the curing light. And so these things have to be put in an engineering type fashion.
Yes.
The design has to be engineered correctly, and it has to be done correctly. If any dentists are listening, they have to know what C factor is and try to keep that as low as possible. But, what happens a lot of times is that these white fillings become very uncomfortable right after they're put in. I know a lot of people, they had their mercury fillings taken out, they put the white fillings in, and they weren't put in a biomimetic fashion. So when the filling shrank away from the floor of the dentin, or that second layer underneath the enamel, that allowed the fluid from within the tooth to enter this little space. And as they chew, this pumps the fluid back and forth. They feel it. It hurts. Sometimes the dentist will think that it's maybe a high filling or something like that.
How do we do modern dentistry versus older fashioned dentistry? where we preserve a lot more of the natural structure of the tooth, which leaves much more for the next dentist, if anything ever has to be redone, to work with, which is much better for the patient. Also, I really like that you cited here 8% of dental procedures are based on solid research, only 8%. So you've got a lot of exploration in your books and on your continuing education videos, showing how diagnostic and minimally invasive procedures can save consumers over 80% of their dental care dollars over a lifetime, and even better, assure better health. I appreciate that.
Yes, and that's what the biomimetic dentistry is all about. One of the videos that I have is called "Fee for Service is Killing Us," and it shows that, I mean, it always goes back to something. Does it go back to money? Does it go back to insurance? Of course it does. And the way our insurance fees are structured, it doesn't really reward dentists who are doing the best jobs. So biomimetic dentists aren't getting what they need out of it. So I kind of talk about that, but I think it's just so important. A patient once told me, and I guess I've heard it more than once, that they just think of their teeth as rocks, but they're not. They live, they breathe, they flex, they flow, and they have to be able to do that. You talk about airway, that people clench at night, for instance, 6 times harder than they do during the daytime. So those teeth have to be able to flex. And so the filling it's almost like you have to make it earthquake proof. So
that's a great analogy.
Yeah. Yes. And who doesn't want to save 80%? And it's not really what they have to spend. It's just that downstream health consequence when your teeth start failing. Then, you just want to stay as healthy as you can, and teeth have a lot to do with that. So anyway, so that's one of the things. We can probably leave that subject for now, unless you had any other.
Okay, I know there's a lot of other things we also want to talk about. I know. Let's talk about nutrition and lifestyle strategies that you discuss that resist inflammation, normalize blood pressure, triglyceride levels, and protect the genome for future generations. That's huge. It's not even about just you. It's about
hours. Yes, it's all about the future.
We'll spend 5-10 minutes maybe.
It's
hard to do. This is like ultra TED Talk.
Actually, I'm thinking that it might be more important. Let me just start with a story. If you, I had a patient that I was supposed to clean his teeth, and the doctor showed me the x-ray. She wasn't going to be there the next day. And I looked at it, and there was only like 2 millimeters of bone left around the teeth out of maybe 10 to 12, depending on which tooth. And I'm like, oh my God, we're keeping these teeth, and his lifestyle not support. You as a dentist know that that's just almost untenable. And I was just ready to kind of talk to him about that. And when he came in the next day, because I thought, what would the point be? But he came in, and it was really strange because I've never seen it before or since. A person with gum disease that hasn't had their teeth cleaned in a long time, they're going to have a lot of this black tartar all up and down their roots that you have to usually sneak in under the gum lines and remove, right? And I thought this would be a very difficult cleaning, and it would just, whatever. But he shocked me because his tissues had shrunk down to the level of his bone. So all of that root exposure was there with all of the tartar. And you know what? Those tissues were really, really healthy. And I was so shocked.
Wow.
Because, we know that the tartar should hold the microbes and everything. But, and I had told my boss the day before, it's like, this is contributing to heart attack country, and
yes.
He goes, oh no, he already had a heart attack. And I'm like, so really? Yeah, we're going to try and keep these teeth with all that inflammation. But when he came in, I had been writing Mouth Matters, and I had put forth all these different things about, sugars, grains, these sorts of things. And I asked him, I said, so did your heart attack scare you half to death? And you did a lot of research, and you followed a lot of the tenets that I talk about. And we talked about it for the whole, 2 or 3 hours while I was working on those roots. And he was on board with all of it. And I thought, Well, that's interesting. If you really change your lifestyle, how much inflammation you can really get rid of. I would say for most, excuse me, for most people, that's pretty impossible. But I mean, to do
A
just
lot of people can really, yeah. Well, there's a whole lot you can do. I have had people totally like they change their cholesterol levels. They cut their bad cholesterol number, so to speak, by like a third by taking different supplements. I mean, it's very well documented. That is possible. I know some people want to debate whether that's possible, but I've had it happen. I don't know if it's possible.
Oh, yes. I just mean for the tissues to shrink 10 millimeters and be healthy in the presence of all that.
That's crazy amazing. Yeah.
Beyond, what I normally see, but take it for a more typical, I know a lot of people in my sphere of influence that have knocked, say, 25 years off their physical age by following some of the tenets that I talk about. So gut health, I can't imagine anything being more destructive than sugar, and grains pretty much turn into sugars in the bloodstream. A lot of people aren't.
And alcohol is sugar, basically.
Oh, and yeah, that's the worst.
That was a debate we had in our house a few years ago, whether alcohol was sugar. That was an education I had to take home and make sure people understood.
Yes, and in my book I talk about colorful ways that really get people's attention about how sugars really do damage your blood vessel walls and all that kind of stuff. But yes, alcohol is definitely a part of it. And I could bring up my partner who, a couple years ago, he did drink alcohol every day. He wasn't an alcoholic, but he did drink every day. And I didn't realize he had some other health issues, but he did. And he started just following along with my diet and lifestyle, and he's been thrilled to see the changes in how he feels, how he looks. His kids are surprised and pleased, and now they're starting to listen. It's really kind of cool. So
that's really
but cool. It's such a big, Mouth Matters, is the book that largely goes in the nutritional aspect of things. I go a little deeper into it with Primal Dentistry, where I'm talking about gut health, because you've really got to have gut health before some of these other things make sense. But again, some of those things enter.
Let's talk about why that is. I know why that is. Well, I don't mean like I know this, but for those of you listening, a lot of the bulk of our immune system cells are located in our gut, and the type of bacteria that reside in our gut influence how we think, whether or not we feel depressed at times, how we absorb and store fat, and how we use sugar. So they really, a lot of those bacteria that are not helpful to us, or like Candida, which is like a yeast, that they thrive on that sugar. And when you don't have it, they crave it, and they make you crave it. So some of these diets that are out there, anti-inflammatory type diets, help us to cut that craving. They help kill off some of those bacteria or the yeast, like the anti-candidal diet, and they really support that overall health. And then it helps, like I said, store fat, or how you store fat, how you use sugar, or how you can get rid of toxins even.
Yeah, I was going to say how to detoxify. Yeah, it's huge. Methylation, for instance, is one of the everybody listening right now is methylating. Every cell is doing it all the time, and it's basically adding or subtracting different groups. We don't want to get into the chemistry of it, but you need to be able to methylate well to function well, to have good brain health, and you can't methylate well if you don't have a healthy gut microbiome also. So
like gene SNPs are what you might be referring to. That's how I think of it. Gene SNPs, SNPs.
That's part of it. That's part of it. Yeah, gene SNPs. You can have. There are a couple of places, a couple of genes that can hurt people's ability to methylate, but there are a lot of other things that keep you from methylating well, and having bad gut health is one of them. Alcohol, nitric oxide blows that pathway. Mercury blows that pathway. Mm-hmm. So, in dentistry, we need to be looking at some of the more subtle difficulties with that. So some of the clues that your listeners might know that your gut microbiome is out of whack is honestly drinking a lot of coffee. That's absolutely going to cause that. If you do suffer a lot of recurrent yeast infections, or you have bloating or excessive gas, if you crave sweets, or have a white tongue. So there are a lot of things, though, you can do to optimize your methylation pathways. So I would suggest that probably everyone in the dental field has trouble methylating well. And it's a very complicated pathway.
You mean people that work in the dental field?
Yes, because we're exposed to mercury and nitric oxide all the time. I try to minimize it, but we're in it. So
right.
So whether or not we have that gene, we're going to have trouble methylating. But I would go so far as to say that I think that anyone who's proposing to be a dental student, or maybe even a dental hygienist, or just be in the field at all, it's just that dentists put so much of their education and time and money into it, and they're most at risk if they can't continue in the business. We were talking the other day about a gene called ApoE, which is a protein in the brain that helps you get rid of heavy metals, fats, cholesterols, and things like that. Now, talk about some rough genes. You can have ApoE4, which means 2 parts on that gene that should have cysteine on it which is an amino acid, have arginine on it. Well, cysteine helps you remove mercury and all of these things from the brain. Whereas if you have arginine on those little places, you're not going to be able to detox. So a lot of that mercury is going to accumulate in the brain and be very tough on these people. So if you inherited, ApoE4 from both parents, you're going to have a really almost impossible time of getting the mercury out of your brain. So that and the inability to methylate well, they should be educated on it. They should be tested, and that way they know that they might be able to tolerate some of the things that we are experiencing within the profession.
Yes, that and the test we're talking about is generally a blood test. So historically in medicine, silver was antimicrobial, which is one of the reasons I believe we kept it or used it in dentistry. It was we liked that it was antimicrobial.
Yes, and we think of it as being non-toxic. But and I started off writing my chapter, to be perfectly honest, on silver, and thinking, I was so positive about it because it is something that the general public can easily get a hold of, compared to, say, ozone gas or something that's just almost impossible.
And you have like colloidal silver, for example, that you can buy over the counter.
Yes. Yes.
Bites and things.
And then people are making it at home and all kinds of things like that. So yes, and I'm going to talk about colloidal silver in just a second. But if we think about proteins, let me take it now that we've talked about candy. Does everyone know, I would imagine, what those Christmas candies look like with the little ribbon candies that touch each other? So if you imagine that proteins are structured like that, certainly much more complicated, but where these touch each other, those are held together by sulfur bonds. And unfortunately, silver as well as mercury pop those sulfur bonds. So all of a sudden proteins morph into a shape that they shouldn't be, and they don't necessarily function as optimally as they should. So I have a problem with that. And in fact, that's one of the reasons why mercury kind of messes with the methylation cycle, because there's a lot of fragile enzymes, and enzymes are proteins, and it'll pop those bonds. And so that whole complicated pathway kind of falls apart for a lot of people. So
those are sulfur bonds, I believe.
Those are sulfur bonds. Did I say silver?
They're silver and they have. Well, we were talking about how silver affects those, or can affect those.
Yeah, it breaks them. So then the proteins become a different shape and they become non-functional. I mean, I think of always form follows function and function follows form. So if you don't have the protein folded just right and the sulfur bonds hold it in that shape, then you don't have the same protein as what you should. And that also matters with genes, which are also, proteins. So,
and you start turning on things that might not have been turned on, or things don't work like they should have worked.
Yes.
Like a bad grocery cart.
Yes. And so, yes, like that. And that's what I think of methylation too. It turns things on and off. They're like little off and on switches. And so if you're not methylating well, those switches aren't going to be working very well. And another thing that it does is it interferes with how microbes use iron, but that also affects humans as well. So the premise of primal dentistry, a lot of the premise is how to get your mitochondria up and functioning well, because I think that's the new thing is, you're not going to be healthy if your mitochondria aren't functioning well. Well, what's a mitochondria? Basically, you've got them packed into each and every cell, and they're making energy in the form of ATP, and they've got to really pump that out and try not to have a lot of oxidation while they're at it. So unfortunately, iron determines enzyme function, and enzymes run the show. We have probably about 100,000 enzyme reactions happening every single second in every cell.
Wow.
So we don't want to be messing with those enzymes with silver. Also, your DNA makes these iron sulfur clusters that help produce DNA and stuff like that. And so you really don't want to be messing with that. So if you have some disturbances with this because of high silver intake or something, you might have some neurological, blood, and metabolic disorders. So one of the things that I thought was really, really interesting, though, when you were talking about colloidal silver, a lot of people are using the nano silver as well.
So
and I know that medicine is using it a great deal too. But these nanoparticles, it's interesting because they can cap the production at any point. They're in different shapes and so on. And I think people who are into energy medicine understand that your cells, every part of your body is resonating at a different frequency. And so they can cap some of this silver at different points, and there is some resonation that goes on with it. But unfortunately, nano silver particles are about the same size of the pores in your cell walls. And so if you're taking a lot in, you can kind of clog up those, and they damage the liver. So yeah, you don't really think in terms of that. So, and when you think of energy medicine, one of the things my patients told me, she goes, well, cats purr to heal themselves. It's that frequency that helps to heal them.
And we can hum and do that too.
Yes.
A little bit, yeah.
Yes. And I love energy medicine. We don't have a lot of time to talk about it, but it is kind of interesting to think about. So there may be some benefit there, but the very idea that it clogs nuclear membrane pores and protein chains in human cells, I just don't like the fact that it can bother the function of those. So I know the dose makes the poison. So I just don't believe, like a lot of my clients take maybe a teaspoon or two daily prophylactically, which I believe in all of that. But I just think that, especially since I found ozone, and I know you wanted to talk about that, but there are so many ways we can use ozone. Silver is mitotoxic, but ozone actually increases the number of mitochondria and their function, and I love that.
Maybe an easy way to think about that. I actually am in Denver at a conference right now, and I was a little short of breath this morning, low blood pressure this morning, and I forgot how high up we are, and I'm not used to it. So when it's like, if I could have had some ozone, maybe I just would have felt a little bit better. I didn't have any, but that might be a way to think about it: high altitude versus just sea level.
Yeah, but you have to be able to use ozone, and I know enough about it to where I prioritized and bought an ozone generator, which not everybody can do. But there are various strengths of it, and there are things that they can do. So specifically talking about it in dentistry, what can a patient do? I know that I have a video where I talk about oral hygiene and how to, if you go under videos, I show about how to use that ozonated oil under your gums and so on. And not under your gums, but also in between your teeth. I'm really interested in this new product. My ozone generator takes about 20 minutes to create ozonated water, which then I could, use to deactivate pesticides and clean everything I wanted to without any toxic chemicals and all that. But 20 minutes, I mean, really, I just don't have the time for that. So They have come up with this. These guys are from MIT, and it's a spray bottle that you can get 2 parts per million ozone, and they're using it in food processing. And I'm thinking, okay, as soon as that test bottle comes, I'm going to be spraying off my broccoli and everything, and strawberries, everything that comes home, using it for because I just can't.
That's cool.
Yes, it is.
I haven't heard of that.
I know. In fact, I'll let you in on it, but. I will probably be posting that to my website as soon as they do it, because you need to have something that's a little bit more instantaneous. Hydrogen water and ozone water. There's another one called BioSure out that you can get that on demand, but I'm in the middle of, trying. That's also just now coming into the country. I think ozone is really starting to hit really big. So it just wins over silver every way you can think of. Anyway, one of the salespeople was talking to me. One of the things that we have autoimmune issues. And so he has, oral lichen planus, which is an autoimmune situation. It looks like a little white webbing
and on the inside of his cheek.
And he's just spraying it with water, this ozonated water every day. And he says it's not completely gone, but it has sure subsided a lot. And of course, then I recommended, I said, well, ozonated water is great, but in your mouth, you can use ozonated oil. So I just recommended that to him. Maybe not that I was his dentist, but whatever.
It's good. It's good. I also want to mention,
people listening may not know that there are levels of ozonation. I know Eric Zaremski. You said that's who talked to you.
Yes, that's who talked. We did a show on ozone a few months ago with Dr. Eric Zaremski, and he's in the San Francisco area as a dentist. He teaches a lot of other dentists about ozone.
Yes,
that's a great program.
The more unsaturated an oil is, the more ozone it's going to be able to hold. And so I quite frequently recommend to my clients to use the ozonated olive oil. It might taste a little less than, say, the jojoba oil, but it has a better flow to it. And
it's going to do more. It's be more effective.
It will be much more effective, yes. And we have so many micro ecologies in our mouths even. So a lot of people are testing their oral pH with pH strips. And I talk about that. And, we always want that to be done. But we can't forget that there are little pits in teeth, and there are, like a crown margin, or most filling margins are going to look gigantic to a bug, and they'll want to go in there. So anyone who has a crown, I highly recommend that they use an ozonated oil on, what are those little picks? Everyone, is it Orofacial?
Like StimuDents or they're just different.
There are many ways.
Yeah, there's different ones out there. I'm not great at names of brands of things sometimes, but I'm glad you brought up about the differences in the different oils. And I've had really good success in my practice with ozonated oil for somebody who has like a candida mouth infection, thrush, that sort of thing, and under dentures, things like that. I've had better luck with that sometimes than, maybe they've been on multiple doses of, these Mycelex pastilles,
right?
Antifungals, and the ozone really, they like it. It tastes better. It's not so weird because they associate yeast infections with other yeast infections, and it works well. I think we got a
manifestation, though, of a systemic problem.
That's so true.
But it's miserable, and you do have to treat it locally as well. But here's something that I wanted to say.
We've got 30 seconds, and then we got to do one more break.
I have a couple of patients who've used the ozonated oil on their night guards and dentures and things like that. You don't want to do that. That's a good place for silver.
Carol Vander Stoep. She's an author, educator for medical and dental professionals, and also is a dental hygienist. And I do want to mention, Carol has 2 different series of videos available through her website, which is primaldentistry.org, PRIMAL dentistry.org. And she has a show special on her videos. There's a series for the general public, and then a series where you can get up to 36 hours of continuing CEUs, continuing education units for medical or dental professionals of all kinds. And let's see, she's got a whole bunch of specials. So please, I will have it posted on my website. She's offering the special through September 13th. And if you purchase the book, Primal Dentistry, Less is More, you'll receive a free digital version of Mouth Matters. which is her second book, How Your Mouth Ages Your Body and What You Can Do About It. Another bonus is if you invest in the Functional Medicine from a Dental Perspective video series that's geared towards the general public, you'll receive a free digital version of Mouth Matters, How Your Mouth Ages Your Body and What You Can Do About It. Mouth Matters, that book, Carol, is excellent. It is deeply well written. I've shared multiple chapters of it with my dental team. I hope it's brought up our education level where we can serve our patients a lot better than we used to. You have a third bonus here, and I really appreciate these bonuses. For dental professionals, you can receive a 50% fee reduction for the discount code. Email KINB like boy 2002 at primaldentistry.org for access to the full version of Functional Medicine from a Dental Perspective course, offering 36 hours of Academy of General Dentistry CE credit. That's an incredible amount of dentistry, because we only need, I shouldn't say it on the air, but at least in my state, 40 hours every 2 years. Most of us get a lot more than that, but right there, you could solve your whole CE issue, and it's super information, absolutely up to date, absolutely current, really cutting edge and above the curve. This is going to be a tsunami, all this functional medicine as it hits our profession of dentistry. I'm so excited to know you and feel like there's a kindred spirit out there. You've got more other specials and more details. It will be posted on my Facebook page and hopefully on United Intentions Facebook page. And I'll also have it on my Whole Healing Dental website. It's running my mouth again.
I wanted to add that one of the reasons, it took me a long time to put together that dental training series, 16 videos and all the ancillary materials that go with it. But for the first time, I am cutting it in half, because what I wanted to do was, the general public is really key to this. And when we wanted cosmetic dentistry, dentists had to learn cosmetic dentistry if they wanted to stay current and have the patients. And so I would really encourage any listeners who purchase this and want that from their dentists. Yes, they can go searching for other dentists, but I would really rather that they talk to their dentist and say, what about this biomimetic dentistry? Or what about early repeatable diagnosis? I mean, I'm not seeing what I really want, but I love our association. I mean, that's what really needs to happen, I think.
That creates a pressure on the dentist to keep up with our education. Look outside the box. We need to be aware of what the rest of medicine, the medical world, is saying about our profession.
Yes.
And sometimes our studies are not holding true like they used to, because now we have more new data. We need to be aware of what that is, and we need to make it more available to our profession, to the medical profession, and show that we're working together, because then the patient wins. We really our Hippocratic oath is to do no harm, and we're here to help and serve. And this kind of material is excellent for that.
Thank you. I've had a lot of fun with it, and I've learned a lot too. I mean, my lifestyle is a little different than it used to be.
Tell us about that. What have you been doing?
And I have an organic orchard and all of those, sustainability things. But I ate grain, and or whatever. There's, and everybody's going to read the material and come to their own what they want to do and what they don't want to do. But I do believe that most dentists really want to know these things, but they haven't been exposed to it. I don't think they've been exposed to it at all. And I think the other thing that I think is really important is that I don't want them to feel threatened. And
no, and then this is again, being able to date ourselves, what we knew then versus what we can know now. It's not, it doesn't need to be we are over here and they are over there, or a
right.
Of any kind.
But the other threat that is, you worry about, well, if I catch all that decay early, and I have run into this, well, then how am I going to maintain the practice financially if I'm not doing expensive crowns and this and that? So going back to that video, fee for service is killing us. It's fascinating when you start delving into it. The gentleman that I made that tape with was talking about how he's making a lot more money, which is not what it's about really, but it is serving his patients much more. And everybody's winning. Everybody's
winning.
Yeah.
There's so much need for this type of work, and people want to have an appreciation for how they want their bodies to be treated, and more people are chronically ill, and a lot of us don't want to end up on a regimen where we're dependent on prescriptions or chemicals. We don't want to ever get to a point where we need those types of things. Sometimes you need them, but we all just want to age our best and have our mental faculties and our physical abilities as long as possible.
And dentistry really, I didn't really realize how much it impacts everything. So I know you know a lot about airway, but I was thinking about, we have these little heads that, we have all these little channels through which everything feeds the rest of the body. Yeah. And so just going into airway development, that if a person mouth breathes, if they don't have the lip seal, all those correct oral postures, they're going to have that 3-dimensional facial contraction that is probably part of my favorite. Everyone's favorite blog is Facial Meltdown that I do. But one of the things that I didn't really appreciate was that the connection in this orifice from the head to the rest of the body is much more narrow. So you have all these things going through a much more constricted space. Who'd have thought that could lead to a lot of oral systemic issues that, again, arise from the mouth? It's just the strangest, most subtle things that nobody's ever thought of that impact health.
It's like we have to breathe every few seconds, or at least a few times a minute to sustain our survival. What we could do without food for maybe a month or so, we could do without water maybe for up to a few days, but we can't breathe or do without breath for more than a few minutes. And when we do things that where we're not, our diet doesn't help us to develop our jaws, we don't develop the mid-third or the maxilla or the mandible, and then we constrict all the same things that have to be in this small area, like our airway, we see an insurgence of asthma problems, focus issues, because we don't get proper oxygen to our tissues. We don't heal. We can't sleep. It's just super impactful.
Ken, stop. Sorry.
It's all good. It's all good. So
some background noise. I was just trying to stop that.
What we continue to learn more and more right now is how much a good diet our whole life. It's like wearing good shoes. As a young child, if you have good shoes, you're more likely to have healthier feet later in life. And actually that can impact your bite as well. We found out on the program a few weeks ago. But it helps develop your airway. And
nothing more important. And we got to stuff that tongue in the airway. And so if we have another second.
We do. We have a couple more minutes, actually.
Okay. I had a blog that I don't think anyone's really pointed out, and it really worries me. I do work in a biological dental practice, but I have a lot of clients who are trying to do mercury detoxing or whatever kind of liver detoxing and so on. But we forget that our detoxification pathways mostly are active at night. And so if we have sleep apnea, because we didn't develop correctly here and our tongue doesn't have space, you can learn more from, Amy or what I've done. It's all over the place. I think before anyone starts doing a detox, especially a heavy metal detox, which can be very damaging if you're not keeping on it exactly, you're in trouble. And so I really encourage everybody to have sleep apnea testing before they start a heavy metal detoxing. So that's
a great idea. I've actually been through a heavy metal detox, and I was sitting next to a whole bunch of chemotherapy patients when I was going through it. It really depletes you of all kinds of energy. And if you aren't going in with your best immune system as best you can, even though you don't have a great immune system because you can't detox well or you're so plugged up with chemicals, but it just makes all the difference. And your success and ability to get through the program even.
Yes, I can tell you, I didn't realize I had sleep apnea, and I have had it, and expanding helped a lot, but then I got older and you lose estrogen and things happen, so then I had it again. So I have treated again, and it's amazing the difference between how I feel when I treat sleep apnea and not. So I think it's just very, very important.
Well, there's even a new laser, the Lightwalker laser that's out. They have a protocol for something called they call night lace. And there's a study out that shows that after just one treatment, it's sort of like, think of like laser hair removal. You do several treatments like you might for laser hair removal. But after 3 treatments, 85% of people have a much better sleep, good night's sleep. But after just one treatment, I think it's 55%. See a marked improvement in snoring and just overall ability to breathe when they sleep. So we're continuing to see evolution. It's everything's changing so rapidly.
Very rapidly, yes.
So again, I want to just reiterate, Carol has some specials going on. We're going to have those posted at the end of the show, and I'll have it also on my other website, wholehealingdental.com, about the show specials. And if you would like to contact Carol, or first of all, you can buy her books, Primal Dentistry, Less is More, and also Mouth Matters. And probably the best place to go to buy these books is at primaldentistry.org, her website. Any other contact information you would like? We have just 1 minute left, Carol.
And I encourage people to write me because I want to know what people's concerns are. I love feedback because I'll turn over backwards just like you will to make things more understandable, more accessible. I really encourage feedback because that's how we know what everybody's thinking. So,
what's the best contact? Do you have an email that you give out ever, or
just Carol at primaldentistry.org?
And Carol, you spell your name CAROL at primaldentistry.org. And Carol, I just want to reiterate, I'm honored that you came on our program. Like I said, I met you about 1.5 years ago at an ALF conference, and we were talking about airway, and you had just come out with Primal Dentistry, Less is More. That book, it's amazing. I couldn't put it down. It's very dense, but you did a great job breaking down really complicated things into vernacular or common speak, and I appreciate that. And I just really hope you continue to see an explosive growth in your programming. It's excellent.
Thank you so much. The reason why I hope for that is we just need to change dentistry, and it has to happen from the ground up. So thank you to the listeners as well, and thank you for hosting me.
All right. Thank you so much. Thank you.
Hi there. I'm Dr. Amy Dayries, and I'd like to thank you for downloading a copy of my book, Solve Your Sleep for Better Health. Just click on the link. Together, we'll take a closer look at what's keeping you from getting to the core of your snore.